What if an AI could run an entire hospital? I know, it sounds like something straight out of a sci-fi movie, right? But believe it or not, a new virtual world is actually making this happen. So today, we're going to dive into how technology is pushing healthcare way beyond the traditional doctor's office.
Okay, let's start with a number. 10,000. Now what is that? Well, get this. That's how many patients a team of AI doctors can treat in just a couple of days. A couple of days. To put that in perspective, it would take human doctors about 2 years to do the same thing. So how is this even possible? Well, the secret is this brand new, kind of revolutionary idea, a completely virtual hospital.
And that brings us to the Agent Hospital Now. Now, let's be clear, this is not just some fancy new app on your phone. Oh no, this is an entire virtual world, and it's designed from the ground up to completely revolutionize how we think about medicine.
So this was just launched in May of 2024 by researchers at Tsinghua University. What they've built is basically a simulated environment where AI is in the driver's seat, and this allows us to test all kinds of medical scenarios and learn from them at a speed, we could have only dreamed of before.
So what's actually going on inside this place? Well, every single person you'd find in a normal hospital, we're talking doctors, nurses, even the patients, they're all autonomous AI agents. They're powered by those large language models, like the tech behind ChatGPT, and they can all interact on their own. And this is a total game changer because it means researchers can run these huge simulations. Imagine modeling how a new virus might spread through a city or testing out new ways to run a hospital, all without putting a single human being at risk. It's incredible.
Okay, a virtual hospital is obviously an incredible tool. It's amazing. But you might be wondering, why is something like this so necessary right now? Well, it's because it's designed to solve a really fundamental, deep-seated problem that's been plaguing healthcare for years. The fact that our medical data is completely trapped in what they call silos. Let me break that down. Think of it like this. Your family doctor has one piece of your health puzzle. Your insurance company has another piece. Your pharmacy has a third. And none of them are talking to each other. They're all operating in their own little separate, closed-off worlds. And, as you can probably guess, this separation just creates massive headaches, friction, and a ton of inefficiency in the whole system. And really, that's the great divide in healthcare today. On one side, you've got our current system, right? The data's all chopped up, everything's super complex, and if you're an innovator trying to build something new, good luck breaking in. But on the other side, there's this potential future. A future where we have a connected ecosystem. The data is unified, access is simple, and the doors are wide open for new ideas and innovators.
So the big question is, how do we get there? How do we move from this messy world of silos to a truly connected ecosystem? Well, the solution is really all about building bridges and, tearing down those walls that keep all our important health data locked away from each other. Building this ecosystem really boils down to 3 key steps. Okay, step 1. We have to unify all that data. The idea is to create a personal, super secure cloud space for every single citizen's health info. Step 2, unify the software platforms. Think of it like a centralized app store, but for trusted, verified health services. And finally, step 3, sync up the user interfaces. We need to make sure the experience is seamless and simple for literally everyone who uses it.
And you've got to understand, this system isn't just about doctors and patients. A real ecosystem connects everybody. We're talking about citizens right from the day they're born, not just when they get sick. We're talking healthcare providers, insurance companies, doctors, the folks who make medical devices, and of course, the big internet technology providers, everybody collaborating on one unified platform. Now, I know this all sounds fantastic in theory, right? But what does it actually mean for us in the real world? Let's take a look at the actual benefits we'd see when a connected system like this really starts to work.
And the amazing thing is, the impact isn't just some far-off theory. It's actually starting to happen right now. We're seeing doctors using the AI tools we have today to slash through all that bureaucratic red tape and really fight for their patients in super practical ways. Let me give you a perfect example. Take Dr. Clifford Sturmer. He's using ChatGPT, but not for what you might think. He's not using it to diagnose a rare disease. He's using it to go to battle with an insurance company for his patient. So here's what happened. His patient needed an essential procedure, and the insurance company denied it. Classic story, right? So Dr. Sturma turned to ChatGPT and had it write a super detailed, scientifically referenced appeal letter. And just like that, he used AI to save himself hours and hours of frustrating admin work. And more importantly, he successfully got his patient the care they absolutely needed. And Dr. Sturmer's story is really just the tip of the iceberg. It shows what's possible
When the system is connected, it creates this ripple effect where literally everyone benefits. Patients and citizens, you get better access to care and all the latest innovations. Doctors and providers, they spend way less time on paperwork and more time collaborating. Innovators, they can finally get their new solutions to the market faster. And for researchers, imagine the insights they could find with access to all that big data. So all of this is leading us towards the future, right? A future where technology is woven into the very fabric of our health. But, and this is a really important point, building this new world isn't just about writing better code or creating smarter algorithms.
No, it actually requires a whole new generation of professionals, people with a completely new set of skills. They're calling them smart talents. And these are the people who can really navigate that tricky intersection where health, technology, and data all meet.
And this brings up a really crucial question, not just for educators, but for all of us. What new competencies does the next generation need to have to really thrive in this new ecosystem? I mean, the future of healthcare isn't just going to be about doctors or programmers. It's going to demand people who are a hybrid of both.
And it's also a question for all of us, as citizens. How can we leverage our own media and tech literacy to actually contribute to this? How can we help shape this new healthcare ecosystem so it works for everyone?
Let's end with this quote because it's powerful and feels almost inevitable at this point. Everything that can be technified will be technified by computer. The integration of tech into every corner of our lives, especially our health, really isn't a question of if anymore, it's a question of when. So the real challenge for us now is to make sure we build that future thoughtfully, inclusively, and with human well-being right at the very heart of it all.